Hello, and welcome to another episode of Skin Hue, a monthly YouTube series where we talk openly and honestly about elevating our skin health and wellness while demystifying the healthcare system, allowing us to live a more healthy and modern lifestyle. Today, we're going to sit down with Dr. Keira Barr. Not only is she a dual certified dermatologist, she's a leading author, she's a former dermatology professor, and she's also the country's leading expert when it comes to women's health, holistic health, and skin health. So who better to talk to about this all-important topic of women's health? So let's jump to it. Hello, Dr. Barr. Welcome to our show.
Well, hello. Happy to be here.
I'm so glad that you're here because you're not only just an expert in the topic of conversation today, but you're also a very supportive advisor and mentor to me personally and what I'm trying to build for women who we're talking about today.
Well, let's get to it.
Yeah, let's get to it. So I have my notes here. So there's a lot of good things that I love about your background that's going to really shape our conversation. So I want to make sure that I have this right. So you're considered a leader when it comes to women's medicine. You have found a really great way to create a bridge between hormones, skin health, mind and body medicine to optimize, which is a part I love, the women's midlife experience, not just her whole journey, but that midlife experience, which I definitely feel is not talked about enough. And then also you've been a medical school professor, you're involved with clinical trials. And so I just want to know, how did you create such a well-rounded experience, yet with a specific market or a niche?
I'd like to say it was some elegant journey. It was very well thought out. But to be perfectly honest, it evolved because my own health struggled. So, this dates back about a decade. Oh my gosh, a decade. And I was in academic medicine. I was, juggling the career and the kids. And I really was not in tune with my body or my health, despite being a physician for quite a long time at that point. Mm-hmm. But my own skin was changing. My moles were changing. They were becoming more atypical. I was having menstrual irregularities. I was feeling more anxious. I wasn't sleeping. I mean, things were happening until ultimately I found a spot on my arm that thankfully I knew what to look for.
Right.
I had to diagnose myself with early melanoma. And that was the tip of the iceberg. That was my wake-up call that all those changes that were happening were my skin and my body's way of trying to get my attention. That something more needed to be done than I was doing, even though I thought I was doing all the things, right? Like exercising, wearing the sunscreen. But our skin is talking to us all the time. So is our body. And it's really our opportunity to pay attention to it. So because my health started to go way down the drain, I went to my traditionally trained medical colleagues, was not getting answers, was not getting help that I felt that I needed. And so it led me to integrative medicine, functional medicine, and that really began this journey of self-development. And of course, because of some of the health issues I had, I wound up having a hysterectomy, which threw me into menopause very early. And that again became a segue of like, okay, I'm going to dive into this. If I'm a physician who has no idea what's happening to my body, had no idea what menopause was all about, how it affects you, here we are. So I started working with various MDs, NDs, PhDs, all the things.
Yeah.
And wound up meeting a mentor who I was using bioidentical hormones, his formulation. I wound up doing a mini fellowship with him, then going into menopause medicine. And so again, it's just your mess becomes your mission and your message. Yes. So at the bottom of all these health issues, stress and exhaustion was the driving factor. So which is why I spend so much of my work really focusing on helping women especially reconnect their mind to their bodies. There is such an intimate beauty brain connection that most people don't appreciate. So everything that I do is informed by essentially because my health, hit the crapper.
Right. Yeah. I want to say right, like it hit the crapper. But like I could totally agree with you. And I feel like all women, no matter where we live, who we are, when it comes down to it, we all have like the same core needs and thoughts that are running through our minds. And that leads me to what you talked about before, like women's medicine or women's health, right? And in preparing for this conversation, I learned that the women's health movement started in the 60s and 70s. And I was like, really? I thought it was like 2018. So, like, can you explain to us what women's health is and what it's not?
That's a great question. I am not an expert on like every single facet, but here's the thing. When we talk about women's health, it's anything that affects our overall health and well-being. And specifically, when we talk about women's health issues, there are really, I think, 9 that are most commonly thought of. Like heart disease is the number one cause of death in women, especially as we hit, we go through menopause, 10 years, the statistics are by age 60, usually with estrogen, we have a cardioprotective benefit. Age 60 and above, we're at the same risk as men. So heart disease is number one, stroke, diabetes, maternal health issues like fertility, and preconception issues, conception issues, urinary tract infections, sexual health. And especially with dermatology, that becomes an issue because sexually transmitted diseases, they pop up. We manage them in dermatology, breast cancer, osteoporosis, and Alzheimer's disease. So those are kind of big buckets that are, very important to be addressed in women's health. To your question of like, what's not women's health? I don't know if anything's not women's health, right?
Yeah, it's like one of those tricky, it's a trick question, right? It's like there's a huge debate about what is women's health. It's such a big topic when it comes to the startup world and creating technology products that are for women. So there's like, investment funds, accelerators for women's tech, right? And they always seem to focus on the menstrual cycle. And you're like, okay, like there's more to it. That's why I loved your response when you said it's heart disease. It's like, oh, that has nothing to do with my reproductive organs, right? So like really framing that conversation. So it's just a open topic that, it's fun to have.
Yes. And right, like, you might not think cardiovascular health is connected to fertility or your sexual health, but it is. Hello, if you don't have good blood flow and you don't have your good nitric oxide flowing, like your sexual organs are not going to be functioning. That's where erectile dysfunction is an issue, so nutrition is an issue. Eating beets, which increase nitric oxide, so we can get our groove on. Hello, like it all is connected. We cannot, that old song of like the hip bones. That is the problem with medicine, I think, for so long. And granted, I am a subspecialist. I'm a dual board subspecialist. We have siloed the body, and especially from my own experience, like I know that for true optimized health, we have to treat the whole person, mind, body, skin, soul, all of it.
All of it. Exactly. And you're exactly right. Our bodies are not a set of disconnected organs, right? And so our skin is what some like to say, the window to our internal bodies, right? And so what are a few ways that our skin is telling us something's not functioning right on the inside?
Yeah. Oh, I love this topic. And again, until my health fell apart, I was probably in, with the majority of people, especially women, and no thanks to the beauty industry that essentially gives us messages that if something pops up on your skin, you need to cover it up. You need to fix it. There is something wrong
Mm-hmm.
And our opportunity is really to see our skin as a guide, as an ally, as a roadmap for how we can take back control of our health and understand what is happening beneath the surface. Just
Right.
like you said, our skin is our largest organ. It is our first line of defense between us and the outside world. It is a window to and reflection of our overall health and well-being, mental, emotional, and physical. So you can use what you see on your skin. Now, granted, things pop up at times. You're like, this is not convenient. I do not need to figure out before a big
Right.
job interview or a date or whatever. Like, I get it. The timing is not always ideal. However, when, there's so many examples when our hair, if you don't have you don't look good, we don't feel good, Vidal Sassoon, like you're, having a good hair day is a big deal. When you are noticing that your hair may be falling out in more dramatic ways than it had been, you lose on average 100 hairs a day. There are reasons. Stress on the body. It could be an illness like having COVID or the flu. It could be actual mental or emotional stress, and your hair grows in 3 different phases. And that stress could have typically happens 3 to 6 months before you're noticing the shedding.
Right.
Thinning of the lateral third of your eyebrows. Women, are always focused on our brows and our lashes. Thinning of the eyebrows could be an indication that your thyroid may not be working as well. We talk about diabetes is a huge problem in this country. Metabolic issue, blood sugar dysregulation. On the skin, there are some telltale signs of someone who's struggling with blood sugar regulation, metabolic issues, thickening and darkening of the skin, especially around the neck and skin folds under the breasts and axilla or groin, called acanthosis nigricans. Sometimes, similarly, swelling of the legs or discoloration of the skin on the lower legs, again, an indication of perhaps cardiovascular challenges or metabolic challenges. And the list goes on. Psoriasis, eczema, we know there's a connection between a leaky gut and leaky skin, things that the gut skin connection. So your skin is this magnificent informant to help you pay a little bit closer attention and give yourself a little self-care, self-love. You may not know immediately looking at it what could be the root cause, but it's an opportunity to go seek help from a physician who can dig a little bit deeper.
Yeah, and that's a great point when we talk about the root cause, but I'm glad you brought up like diabetes. And so, for myself and the other women who are watching this particular show in our community, when it comes to Black and brown women, we have a lot of diabetes, thyroid issues, cervical cancer, breast cancer. And so like, what are some of the ways that we could look for if we have these signs? And then even more so, I think once we are diagnosed with these illnesses and conditions, how do we manage our skin? Because our skin has to be managed a little bit differently than our counterparts.
Yeah, so this is a great question. So I think the most important thing is getting familiar with the skin you're in. And I always encourage everyone to party in your birthday suit on the date of your birthday every single month. It's a date you'll always remember. So every single month, you get naked, you strip it down before you get in the shower. You're naked anyway. And check yourself over head to toe, top to bottom, between your fingers, between your toes, bottoms of your feet, fingernails, toenails, before you get that mani-pedi, right? Before you put that color on, check your nails. Melanoma, especially in individuals of color, can, we are all at risk of melanoma, but just because you have more pigment in your skin doesn't mean that you are not at risk for skin cancer. So we check for pigmented lesions underneath the nails, sores that are not healing. You think this is so common with skin cancer, especially. I'll have women who, when I was in active practice, would come and say, I have this zit, it just won't go away. I'm like, girl, that is not a zit, that's a basal cell carcinoma.
Oh,
A spot that is a
yeah.
pupil that doesn't go away, something that is itching and bleeding, right? So you need to get familiar with the skin you're in, things that are growing, changing, itching, bleeding, and then going to a dermatologist, ideally once a year, or a primary care physician who's very comfortable and familiar with looking at skin to just check you over, because there are parts of your body that aren't as easy to see.
Sure.
And recruit every provider that you go to, your hairdresser, have them look in your scalp, your ophthalmologist or optometrist, to ask them looking for any pigmented lesions in your eyes, your dentist looking in your mouth, your gynecologist. Melanoma and other conditions happen where the sun doesn't shine. So look, get your hand mirror and look at your intimate bits.
Your intimate
front, back, front, back, top, bottom, because skin cancer, melanoma, cervical cancer, it can, and breast cancer too, can occur on the skin. I can't even tell you how there's been so many times where individuals, both men and women, have come with lumps or rashes on their skin, ongoing, no matter what they put on it, topical steroids, nothing is working, right? So they come to dermatology and you look at it and you're like, uh-oh. You biopsy, get confirmation. It is cancer that has metastasized to the skin. And sometimes that is the first time they even knew that they had cancer. So I don't say that to be doom and gloom and to instill fear. It's just, if you're checking your skin every single month, you're going to know what's new, what's changing, so that you really can take control, be empowered to be the CEO of your body and your health.
Yeah, I think that's really important information. I never thought about, like having a monthly birthday party with myself and my skin, but I think that's like, I'm gonna try that. But also it's like, when you're able to take notice of your skin, you can become a better advocate for yourself, right? So if you go to someone and you notice something on your breast, or, your hair is falling out, and maybe they aren't, familiar with treating people of color, right? Then you can say, okay, you know what? I know this is going on, so I'm going to go get a second opinion, right? And keep trying to figure out like what's going on. And that leads me more into root causes of skin concerns for women, and that's hormones. Right. Yes. So I'm seeing more and more women talk about PCOS, menopause, IVF treatments, and their skin. So I would really want to know, how does a dermatologist really determine what the root cause of a skin concern is?
Again, it comes down to treating each individual as a whole person. We don't just look at their skin. You have to find out, okay, what's happening in your life? What's going on? What are the stressors? When I talk about stress as being at the underpinning of everything, it's what we call the exposome. It's like everything in your world that can create stress on your body. Is it ultraviolet light and air pollution? Is it the food that you're eating and the toxins? And, is it your mental, emotional well-being as well? Everything counts. Everything can have an influence in tipping our hormonal balance out of balance. So basically, it's getting to know you as a person, what's happening.
Right.
And that'll help inform, okay, this is where we start. and there is no one and done, right? Sometimes it is just like our skin with many layers. We start at the top layer, we peel that back, and then we keep going. And sometimes, I did additional training in integrative dermatology, where we're trying to bring in Eastern, Western, functional, and integrative approaches, right? Not every dermatologist has that skill set or has that interest or bandwidth. So you may find, just like anything else, it takes a village. So you may start with your dermatologist and they say, okay, for instance, psoriasis. You have psoriasis. Here's a treatment plan to address the skin. But we know more and more psoriasis is an autoimmune condition. What is triggering that inflammation? Do we need to look at your gut health? Well, not all dermatologists are comfortable doing some of these tests that look at, your stool and the dysbiosis, the balance of bacteria in your gut. So you might need to go to maybe an integrative practitioner or someone who's trained in functional medicine, or, who can help. So sometimes it takes the involvement of other providers to create a healthcare team to get to the root cause. And I know it can feel frustrating, but
Yeah, I think, it feels frustrating because maybe there's not that expectation that you can have a care team, right? Like you can have your primary care physician, you can have your dermatologist, you can have your specialist, but they're all working to get you to where you want to be, right? And then I think thinking for myself, and my own personal experience, having that care team, it was like, okay, I need to go through these different steps to figure it out versus you have me taking all these tests and you don't know what's going on. And then I'm just super frustrated. So I think it's more the holistic experience, but you're also building trust with that physician and maybe even a little bit more trust with medicine overall.
Yeah, I think it can be challenging because we live in a society that instant gratification, right? Quick fixes, fast food. And we think that when it comes to our health, many times the results should be quick as well. And unfortunately, it doesn't work that way. It didn't, these conditions, many of these conditions didn't happen overnight. And it's going to take time to get to the root cause of it, to help heal. And so we also have to give ourselves a little bit of more self-compassion, some grace, and some patience, knowing that things can take time as well. Like for instance, myself, right? Like I'm the skin expert and all, but recently I've had 2 spots on my abdomen, eczema patches. And I know that I'm still dealing with some gut issues. And wouldn't you know it, it's directly over the 2 primary spots in my gut, which is fascinating that I'm able to make those connections now. But I can't just go to my dermatologist. I'm seeing a acupuncturist. I have a functional nutritionist working with me. And, I'm going to have to go see a naturopath who's a specialist in gut health. And thankfully, many of them do take insurance, and because I know that would be a concern for people. Healthcare can get expensive, but I know that not everyone can be an expert in all the things, that I'm going to have to navigate this journey and this roadmap. And I think talking to our friends, talking to our colleagues who have had good experiences. So we have at least a starting place of, well, who do I go to? Well, I found this person because you just ask a lot of questions.
Right. We do have to ask a lot of questions. Given that you did treat women and men, when it came to asking questions and advocating for themselves, like what were some of the stumbling blocks why you believe your patients weren't honest or they didn't believe they could advocate for themselves?
That's a hard one. And I think there's a lot of fear of judgment or shame, thinking that they've done something wrong. And they're going to be judged, especially when it comes to acne. A lot of people would think, well, they're going to think I'm dirty, that I don't wash my face, that I'm doing something. And so they may withhold, or if they've been picking, or, and I think a lot of it does come to that idea of feeling like they need to hide.
Sure.
And so unfortunately, that can get in the way of getting the treatment that they actually need. So I think, being an advocate is also, it's that place of self-love and self-acceptance. Like, this is where I am. This is what I'm struggling with. And I want to get help. So I'm going to have to be honest about what's going on with me. I think especially when it comes to, thankfully, if anything's come out of this pandemic is, mental health issues, touch every single one of us in some way, shape, or another. And it's becoming, thankfully, more acceptable, more commonplace to talk about the struggle. But in the past, I think that was an obstacle that many people struggled with, especially with skin issues. What shows up on our skin most definitely affects how we show up in it. It affects our self-esteem. It affects our self-confidence. And so I think that also has had, in many instances, created challenges for people being able to advocate for themselves.
Yeah. So leading off of that, right? Advocating with yourself when you're in the treatment room. So I know I personally encountered particular physicians that probably didn't have the best bedside manner, right? And maybe everyone's not as assertive or vocal as myself. How do you communicate with that type of doctor about your concerns that you're being heard, just in that moment? And then maybe when you leave, you kind of say, I'm not going back to that particular doctor.
Yeah, I think that's a great question. It's also a bit challenging, right? Because everyone's an individual and physicians are just human beings, and they bring their stuff to the exam room as well. And on any given day, they could be having a bad day, and they're, and just there may be a disconnect. But there's ways to, I think, work around that. I think you could literally say, I don't feel that you're hearing what I'm saying to you.
Mm-hmm.
You have, this is your visit, and you need to, as an advocate, and feel comfortable enough sometimes to say, I don't feel that you're hearing me.
And then be willing to seek care somewhere else.
And be willing to seek care somewhere else, or be willing to have that conversation.
That's true.
I feel like you're hearing me. This is actually what I'm asking for. This is what I need. Are you able to help me with this? And if the physician is a reasonable person, they'd be like, I'm sorry. There's been a communication breakdown here.
Right.
Let's start over, kind of a thing. And sometimes, listen, we are not for everybody, and so there's going to be a personality mismatch, and healthcare is your most precious, like your health is your wealth, right?
Mm-hmm.
It's your most precious asset. And you have to feel comfortable with who you are entrusting your health with. So if you don't feel a connection, you don't feel valued, you don't feel seen, you don't feel heard, you have that right to go see somebody else.
You can. And that's just really important to understand. And also there's one other thing that just popped up into my mind, because we talked about hair, skin, and nails. Mm-hmm. And I found a lot of people don't realize that it all falls under dermatology.
Yes.
I'm not sure where they think it falls, but can you speak to why that is? Is it because they're heavily influenced by the beauty industry that kind of keeps them separate, or maybe it's just something that was just never really shared with society, that it's like that dermatology trifecta?
Yeah, I don't know. I thought that many people knew that hair, skin, and nails. Because I don't
do
know
not.
Go to, or perhaps they start with their primary care physician, and then the primary care physician refers them on, because there are many things that can be easily handled. Because sometimes hair, skin, and nail issues, again, are a opportunity. They are a sign, a symptom of much more going on beneath the surface, like thyroid issues, metabolic issues. Psoriasis can affect your nails, melanoma. Those are things that probably would then be referred to a dermatologist, fungal infection. But some primary care physicians are comfortable dealing with certain skin issues more readily. So I'm not sure where that disconnect came from. But for sure, dermatologists are trained as experts in hair and nails. But I think just because, 80% of, when you look at statistics, a lot of people go to the doctor. I think it was like upwards of 80 or 90% of doctors' visits are for stress-related ailments, and skin issues are among the number one reasons that people go to the doctor. But they're going to go to their primary first to say, hey, this is what's going on with me. And then from there, they may get referred on. But that's, again, I guess my point of bringing that back is really just to always emphasize, like, we need to take care of our emotional, our mental well-being, because it is impacting what is showing up on our skin.
Absolutely. And so just to round out our time together, when it comes to owning your own health or your women's health, like, what would you tell some of our listeners if they were actually meeting with you, trying to get their holistic health plan together, so to speak?
Yeah, I would say start with one thing. We can get, especially if you're on social media or whatever, it's like, do this diet, do that fad, do that trend. Yeah. And you're just like, oh my God, that is just too much. And you can spend your entire paycheck on all this that doesn't work. Right. And
for sure. For sure.
So I think, what I teach the women that I work with is really to get in tune with your body. I mean, just even putting I noticed that I'd never used to do this before. And if you had told me that this is the space I'd be in 10 years ago, I'd been like, that's crazy, right? That's woo-woo nonsense. But literally just getting in touch and understanding that most of us live up here, but we need to reconnect the mind, the body, the brain, and the skin, right? Beauty-brain connection, very intimately related. Our brain and our skin are derived from the same embryologic tissue. They're intimately linked. So what I would say is, what is your biggest challenge or obstacle right now? And look at, okay, what is happening in your life right now?
Right.
Prioritizing, like, how are you sleeping? How are you moving your body? Are you moving from a place of joy, or because so-and-so on social media said you should be, this big around and whatever, and you're doing it to beat yourself up, right? You need to, we want to honor this body that we have. It's the only one we've got. Who are you spending your time with? That influences us significantly. Our surroundings. Is there a lot of clutter? You're like, in my book, The Skin Whisperer, right? That book came about because I wasn't paying attention to a holistic way of living or treating myself with respect at all. Right. I was ignoring all the signs. That book is a roadmap to help people build resilience. And it looks at nutrition. It looks at sleep. It teaches you how to, examine your skin, communication, relationships, boundaries. All of those things, whether people appreciate it or not, may have not recognized, all of that influences the appearance of your skin.
So start with one thing and pay attention to your surroundings and reconnect with yourself.
That's right.
That's it.
That's right. That one thing, I mean, people say like, oh, you should drink like a gajillion things of water. How about if you're not hydrating, you start with like one glass of water, right? Or like, just taking one breath just to slow things down. Because if we can reset our nervous system from fight or flight to more relaxed, right? Being hypervigilant and always feeling stressed out just to relax, like, it's a game changer. So
it definitely is.
Just pick one thing that you can do to set yourself up for success, because then you can build on that. Don't put the pressure on to do all the things. And simplify your skincare routine. You don't need a 21-step thing. Like, just tune out that noise. That is just a money grab. Like, no, you don't need it.
Stop layering and start listening.
Yes, I love that.
Absolutely. So that's what we're going to do. That's your advice. And as always, I really enjoy talking to you, not just because you come with a wealth of knowledge, but because you have the most soothing voice. And I feel is like perfect for this topic. It's calming and it helps us get in tune with our inner self. So as always, I enjoyed our conversation and thank you again.
Thank you so much.